matter of road, I think the government has tried and has done the part they can. There is another take I want to relate to my brother here next to me. According to reports recently, westnile has a hospital that is, according to Dr. Paul Onzubu, the district health officer of Maracha district. He gave a report that due to lack of, there is a shortage of human resource in the hospital. And you find that this has caused a lot of problem together with the people who have, too much in the hospital. Attendance to them is low. You find like you have very many patients and few health workers. And I want to link it direct to what First Lady said. And the First Lady said that in the hospital, you find nurses are congesting the whole place, the trainees, that is what she said, the trainees congest the hospitals, let the institutions recruiting the nurses reduce on the admission. They are admitting a lot. I don't know whether you people saw that, but because now if the health centers claim that there is less human resource, and there is another side saying we should reduce on the admission because of lack of facilities to sustain them. Where?
Yes, thank you, Mr. Francis and Aluma Media. The First Lady, to some extent, I may say she was right. But then the question is, because I saw there's something that she directed the institution recruiting those who are coming in for nursing, that they should reduce on the number of admissions. I think that was the point. But now you see the DSO of Marasha, you saying there is shortage of human resource. Now you ask yourself, it is becoming like a primary school where you go and you find so many, the pupils are there with uniforms, and you see those who are joining S1s, they are very few. So now my question is also coming to myself that now where are those trainees going? The ones that the First Lady is complaining.
And that is the question I'm asking.
Because you cannot say that all these trainees who come for the training, they all fail and they are not actually put in those health centers. So my point is, I don't know the criteria that the government use to bring in these people for the opportunities that needs people. Because we see the trainees are very many, but the people working. So every year that means the trainees are failing. So what I see is that the First Lady, I know there's one problem. There's one time I said, before blaming the whole family, not the person who is heading the family. Because this is a very person who is saying the people are very many and they are crowding the hospitals, and now the other people they have put in to head the district levels, they are blaming, that they are complaining that the health workers are very few. So to me, what I say, this is what needs the government to intervene. Because when the complaint is coming, that means the head of the state should actually come in and intervene. What is the Minister of Health saying about what the DHO of Maracha said? So that means that the Minister of Health should come in and say something, or they act. The problem with this country is that we have preachers of the word. If they were pastors, these ministers, if they were pastors, actually they would be going to heaven, walking. They speak well, but the implementations are very low. Actually, you will not hear them saying something about the implementations. Because now, if they are serious in that Ministry of Health, what the DHO say, by now, at least there will be something. I think the message reached us on the 1st, that was the 1st of October. So I don't know what has come as a result. That's to me.
Okay, thank you very much. And in that very context, there is some statement made that the West Nile people are rigid to change. Others do not want to take their children for vaccination, especially. And they take and they don't complete the doses. They go like, children, babies are vaccinated against very many vaccinatable diseases. There is measles, polios, and others. You might find it will take you months as you need to go. Yeah. Others get tired along the way, and others are discouraged by the very people. Why? They are not sensitized. Human resource there. Now, if we are limiting the number of recruitment of new students to come and take charge of this, and at the same time we are complaining that our people are dying, I will ask Honorable to be Ojok. What is your take about these two statements? How can you link this statement? Does it make sense?
You see, we need to be very, very careful when sometimes we talk in the public about matters that affect Uganda as a country. That is right from, if it is in leadership, from LC1 to the top in government leadership. Whatever you are talking about as a statement made by the First Lady, who is the Minister of Education, people have heard. People have not heard. But I need to also let you know that to my own understanding, if it is true, then I don't know what I will say about that. Maybe you will need to ask the First Lady to let us know where the base of that information
because
is coming
in her
from.
statement,
But
in her statement, she said, because we don't have enough facilities for these people to train them and others, so we need to reduce the number of the new entrants.
No, when you look at the facilities that these people could be trained from, there are so many. In Uganda, we have actually 6,939 health facilities marked and recommended by the government of Uganda. And we have 5 national referrals. We have 13 regional referrals. Those are the ones. And we have also 168 hospitals in the districts of Uganda. So you cannot tell me that there are no facilities where these people could be trained from. It doesn't matter whether they are trained from Nebi district as Nebi hospital. It doesn't matter whether they are trained from actually Karamoja. Because the same training they are getting is the same training they are supposed to use, even at their time of service. So probably when it comes to that, we also have like 54,000. If you look at this, we have 154,073 health workers. And when you look at the population of Uganda now, these are very few people to really man the population. So if the First Lady says they should reduce, to my own understanding, also on the other hand, we are killing education in Uganda. Because you will not tell me to go and study engineering when I want to go for health services. You will be killing my passion. You will be killing the passion of Ugandans. You will be killing the people who should really save lives. So we really need to know the basis from which this is coming from. Otherwise, if we choose to say this is, they always say, do not begin killing off fire. Let me use the simplest English. Killing off fire or switching off fire from the flame. You start from the base. So probably there must be a reason why the First Lady had said that. But to my own understanding, the number of health workers we have vis-a-vis the number of the population of Uganda, we really need more. And we also need more health facilities.
Okay, I think from her statement, she was like, it is not that bad, but because at this time, the facilities are not enough. You get hospital, having very many trainees that those nurses, they have always
And that is what I'm saying. And that is what I'm saying. They should distribute these people in facilities which are there, not really bringing them to Mulago and really they all converge in Mulago. For what?
And that's why she say now they should reduce the number. Now,
for those who can advise, because Ugandans now believe in advisors to stakeholders, please let the First Lady know that there are other facilities that we can use apart from Kampala facilities.
Okay, Yada Moses.
Yes, please.
On these two statements,
Yes.
the First Lady says we should reduce on the number of recruitment, especially on the nurse side.
Yes.
Do you know how much nurses the certificate a nurse student pays almost is the same tuition a university degree holder.
Or even more. It is actually more. It's actually more.
And I'm not well conversant with their salary scale.
They have increased them slightly.
Now, on these two statements, it is worrying the people who have the heart to go and pursue nursing. And most nurses begin from the certificate. You get? That means senior 4. You get? What is your take on the statement that we should reduce the number of nurses, and yet some hospitals or districts lack human resource, especially the health workers?
Thank you so much. The voice of what?
Alur Media, Walma. Yes.
One, let me inform whoever cares that in this country, apart from maybe UPDF, the rest of the sectors do not have enough staff. Because at least for UPDF, I can see the number is big, I see them in the barracks. But for the rest of the sectors, ministries, local government, people are not recruited fully. So there is no hospital in this country, unless when it's private, that is fully staffed to its standard. I've been to Mulago. Of course, I always run campaigns of helping those who are needed, especially those I know, or who come from East, basically. There is no department where the medics are serving the rightful number. They are ever in excess. In fact, there are days I sympathize with the medics. You work on about 200 people, yet you are supposed to be working on maybe averagely 20 people. 2, Mama First Lady, if she wasn't a mother of my mother's age, I would have been harder. But as a parent, as a mother, is now a grandmother. You have no moral authority to say that the number of admissions of certificate holders, diploma holders should be reduced. And yet you are the minister in charge of education, which is a feeding ministry to the health. You are not a doctor. I'm quite certain Mama Levitt, Honorable Minister and First Lady, does not get even panel from any of our local facilities. She moves with her ambulance, perhaps her modernized hospital, if I see her come from. So should not play, should not joke with issues of life. The people of Maracha, if the DHO gave that report is authentic. She should also maybe allow us through Twitter, to inform her, give her the official report. There is a lot of gapping in every sector, but this sector of health is very sensitive. I find her statement demeaning to the students, to the patients, and if those students are there, actually it should be even motivated more. You have had people anointing the medic, interns, especially doctors. Her ministry is in charge of imparting skills, then feed to other ministries. So, can we have a proper planning system train these people. If she feels there are so many, then let us export them to other countries. Instead of saying that you should stop admitting. I find either she is not informed or doesn't have the grandchildren, and should retract that statement with an apology to Ugandans. Because you cannot wake up and say, the number should be reduced honestly, and you are the minister in charge of education. How do I trust now? You have already discredited our system. You are telling others that, you know what, we have a problem. What is her role in planning? And I find a problem. The president should, I think, retire now and be appointing young people like you. Because for us, we still have time to go to this hospital. Me, I get sick from public facilities for my own confidence in them. And I want to thank government, by the way, for having renovated the Busoro Hospital. And we have monitored them very closely, that there is value for money. I also want to take the very initiative to thank the board and the political wing and the locals. For us, our hospital, after its completion, will be the best hospital at that level of the district.
Thank you very much. In 2 minutes,
Yes, please.
you are a professional teacher. Where does this statement leave you that we reduce recruitment? Is education becoming bad?
Thank you so much, Mr. Francis and Duolmoa, viewers. Honestly speaking, I run out of words when I get to hear anything of this kind. First of all, the two statements are very contradicting. You cannot sit maybe before the camera and then tell the nation that we want to reduce on the admission of nurses. And then when you go to the field, more nurses are needed. The first thing they should have done was supposed to be carrying out needs assessment. They didn't carry out anything to do with needs assessment. What are the needs of the society? Someone talked about the population of our country currently. There's no way out you're going to tell me that a nurse is supposed to treat more than 200 patients in a single day like this, and you expect that nurse to deliver to the best. That one is completely bad. So I think there was an error in thinking somewhere. I know these big people, in most cases, someone sits down, makes for them what to go and say. When they stand, don't think that they are speaking their own minds. Some of those things have been scripted and they are just speaking the minds of people. But now I would really advise that before you start to speak, maybe you first get to understand, why should I say this like this? I'm going to say something briefly again on what my friend has just said out. There's what we call expatriating. That is exporting the surplus. If you know that what you have produced is now
In excess.
is in excess or beyond what you can consume, what can you do? Turn into a business now. Develop that business mind. You can sell to other people who can give you money, which money you can use to provide social services to your people. So many things have gone berserk in the country, but someone seems not to be caring at all. So personally, I would say it wasn't the right thing to be said. And earlier than that, we had someone say that the education sector is being killed slowly. Not being killed. It died long time ago. It died long time ago. So we do not know even what is in this. Actually, what the system you're following is in any way beneficial to the current population or the population.
Actually, from that point where you are.
Before even you take us to another point, I needed to say something briefly here. You see, there is difference between powers and authority.
Okay.
And
In a minute.
And whenever we use the powers and authority, we must also use them from an informed point of view, regardless of whoever you are. And personally, the information that you're talking about, First Lady, I am yet to learn more about it after this. But I could say this as a concerned citizen, that if it was true, then something must be wrong somewhere. Because looking at Ugandans, as I had said earlier, the population of Ugandans versus the qualified number of health workers, we still need to recruit more. That is the fact, whether we agree or disagree. But also to the extreme, the numbers that we have, we should also take into note that we do not use them fully. And that's why you see there's a reason that people are complaining, why are we not using them fully? This brings us to the point of wages versus what we spend as Ugandans who are health workers to really be getting after qualification.
Thank you very much. Shortly, we are coming back. And at this point, we take a break.